How would you handle someone under your care who is either confused or upset?
When handling someone under my care who is either confused or upset, my primary approach would be to maintain a calm and reassuring presence. It's crucial to listen actively and empathetically to understand the root of their confusion or distress. I would speak in a gentle, soothing tone and use simple, clear language to communicate. Patience is key, so I would give them ample time to express themselves without rushing or interrupting. If the individual is confused, I would try to gently reorient them by providing clear and concise information about their surroundings or the current situation. Using familiar objects, photographs, or talking about their past experiences can help ground them and reduce their confusion. In situations where the person is upset, I would acknowledge their feelings and validate their emotions, making sure they feel heard and understood. Offering comfort, whether through words or a comforting touch if appropriate, can help alleviate their distress. It's important to remain calm myself, as my demeanor can significantly influence their emotional state. I would also assess if there are any underlying needs or triggers contributing to their confusion or upset, such as hunger, pain, or a need for social interaction. Addressing these needs promptly can often alleviate the immediate distress. Throughout this process, I would ensure a safe and supportive environment, free from unnecessary stimuli that might exacerbate their confusion or upset. If necessary, I would involve other healthcare professionals to provide comprehensive support and care. By maintaining a compassionate and patient approach, I can help ease their confusion or upset and promote a sense of security and well-being.
Tell me about a time when you demonstrated a commitment to the quality of care.
In my previous role as a senior carer at a residential care facility, I was responsible for the well-being of several elderly residents. One of our residents, Mrs. Thompson, had been experiencing a noticeable decline in her cognitive functions, leading to increased confusion and anxiety. Her family was concerned about her deteriorating condition and had expressed their worries during a care meeting. My task was to develop and implement a care plan that would address Mrs. Thompson's cognitive decline and provide her with a higher quality of care. This plan needed to include strategies to manage her confusion, reduce her anxiety, and improve her overall well-being, while also reassuring her family of her safety and comfort. I began by conducting a thorough assessment of Mrs. Thompson's needs, consulting with her family, the nursing staff, and her primary care physician. I identified key areas where she needed support and devised a personalized care plan. This plan included daily cognitive stimulation activities such as puzzles, memory games, and storytelling sessions. I also introduced a consistent daily routine to provide structure and reduce her anxiety. To ensure her emotional well-being, I organized regular one-on-one time with her, where we engaged in activities she enjoyed, such as listening to her favorite music and looking through photo albums. I also arranged for her to participate in group activities to foster social interaction and prevent isolation. I trained the care staff on the new care plan, emphasizing the importance of consistency and patience. Additionally, I scheduled regular meetings with Mrs. Thompson's family to update them on her progress and address any concerns. Over the following months, Mrs. Thompson showed significant improvement. Her episodes of confusion decreased, and her anxiety levels were much more manageable. She became more engaged in daily activities and enjoyed interacting with other residents. Her family expressed their gratitude and relief, noting the positive changes in her condition. This experience reinforced my commitment to providing high-quality care and demonstrated the impact of personalized and compassionate care on our residents' well-being.
As a senior carer, what will you do if a resident refuses to take medicine?
As a senior carer, if a resident refuses to take their medicine, my approach would involve several steps to ensure their health needs are met while respecting their autonomy and preferences. First, I would assess the situation to understand why the resident is refusing the medication. This could involve talking with the resident directly, reviewing their medical history for any past issues with medication, or consulting with their healthcare team to determine if there are any physical or psychological reasons for the refusal. Next, I would communicate calmly and respectfully with the resident, explaining the importance of the medication for their health and well-being. I would listen attentively to their concerns or reasons for refusing and address them with empathy. Providing reassurance and explaining the potential benefits and risks of taking the medication can help alleviate their concerns. If appropriate, I would offer the resident choices or alternatives that might make taking the medication more acceptable to them. This could include adjusting the timing of medication administration, offering it in a different form, e.g., liquid instead of pills, or allowing them to take it with food or drink if possible. Building a trusting relationship with the resident is crucial. By consistently showing respect for their preferences and involving them in decisions about their care, they are more likely to cooperate. Establishing a routine for medication administration can also help, as it provides predictability and reduces anxiety. If the resident continues to refuse medication despite efforts to address their concerns and preferences, I would consult with the healthcare team, including the resident's physician and possibly a pharmacist or psychologist. They may offer additional insights or suggest alternative approaches to ensure the resident's health needs are met safely. Throughout the process, it's important to document the resident's refusal, the actions taken, and any outcomes or changes observed. Monitoring the resident's health closely is essential to detect any adverse effects from missed medication doses and to adjust the care plan as needed. By taking a patient-centered approach, respecting the resident's autonomy, and working collaboratively with the healthcare team, I can ensure that the resident receives the necessary care while maintaining their dignity and well-being.
As a senior carer, if you see someone is abusing a resident, what will you do?
As a senior carer, witnessing any form of abuse towards a resident is a serious and distressing situation that demands immediate action. My foremost priority would be to ensure the safety and well-being of the resident. Firstly, I would intervene promptly to stop the abusive behavior, ensuring that the resident is removed from harm's way. This may involve calmly but firmly intervening in the situation and separating the resident from the abuser, if necessary. Simultaneously, I would ensure the resident's immediate medical and emotional needs are addressed. This could include providing comfort, assessing for any injuries, and contacting medical personnel if required. Following the immediate response, I would report the incident to the appropriate authorities and follow established protocols within the care facility. This would involve notifying the management, documenting the incident thoroughly with as much detail as possible, and cooperating fully with any subsequent investigations. Additionally, I would provide support to the resident and their family members, ensuring they understand the situation, their rights, and the steps being taken to address the abuse. This includes advocating for the residents' best interests and providing reassurance that their safety and well-being are paramount. Lastly, I would work to prevent future incidents of abuse by reinforcing training among staff members, emphasizing the importance of respectful and compassionate care, and promoting a culture of zero tolerance for abuse within the facility. Throughout this process, maintaining clear communication, compassion, and a commitment to upholding the resident's dignity and rights would guide my actions as a senior carer in addressing such a critical and sensitive issue.
As a senior carer, if you see a conflict between two staff, what will you do?
As a senior carer, encountering a conflict between two staff members requires a balanced and proactive approach to resolve the situation effectively while maintaining a positive work environment. Initially, I would intervene calmly and promptly, separating the individuals involved if necessary to diffuse immediate tensions. Creating a neutral space for discussion allows both parties to express their perspectives without further escalation. Listening actively to each staff member involved helps to understand the root causes of the conflict. By acknowledging their concerns and perspectives, I can demonstrate empathy and fairness, fostering an atmosphere of mutual respect and trust. Facilitating constructive dialogue between the staff members involved is essential, encouraging them to communicate openly and respectfully, while emphasizing the importance of resolving differences collaboratively, promotes understanding and consensus. If needed, I would provide guidance or mediation to help clarify misunderstandings and find mutually agreeable solutions. This may involve proposing compromises or alternative approaches that address both parties' needs and concerns. Throughout the process, Maintaining confidentiality and impartiality is crucial to build confidence in the resolution process. Documenting the incident and any agreed-upon solutions ensures accountability and serves as a reference for future conflict resolution efforts. Finally, promoting a supportive and cooperative team culture through ongoing communication and conflict resolution training contributes to preventing future conflicts and fostering a harmonious work environment. By approaching conflicts between staff members with sensitivity, patience, and professionalism, I can effectively mitigate tensions and promote a positive and productive atmosphere within the care facility.
Describe a stressful situation at work and how you handled it.
Certainly. One particularly stressful situation I encountered at work involved a sudden medical emergency with a resident who had collapsed unexpectedly. I was on duty during a busy evening shift when another staff member alerted me to the situation. Upon arriving at the scene, I found the resident unconscious and unresponsive. The urgency of the situation immediately heightened my senses, but I focused on remaining calm and composed to provide the necessary assistance. First, I quickly assessed the resident's condition, checking their vital signs and responsiveness. I promptly called for additional help from the nursing team and emergency services while directing another staff member to fetch the resident's medical file for crucial information. While waiting for medical professionals to arrive, I began administering basic first aid, including positioning the resident appropriately and monitoring their breathing and pulse. Communicating clearly and effectively with the emergency responders ensured they were fully briefed upon arrival, expediting their assessment and treatment. Throughout the ordeal, I maintained constant communication with the resident's family, updating them on the situation and offering reassurance amidst the uncertainty. This open dialogue helped alleviate some of their anxiety and ensured they were informed and involved in the decision-making process. Once the resident was stabilized and safely transferred to the hospital, I took a moment to debrief with the team, discussing the events and identifying any areas for improvement in our emergency response protocols. This reflective approach enabled us to learn from the experience and reinforce our readiness for future emergencies. In the aftermath, I made a concerted effort to provide ongoing support to both the resident's family and my fellow staff members, recognizing the emotional impact of such a distressing incident. By demonstrating leadership, remaining composed under pressure, and prioritizing the residents' well-being throughout, I was able to navigate this challenging situation effectively and ensure the best possible outcome for everyone involved.
Tell me about a time when you adapted your style of communication to get your message across.
In a previous role as a senior carer, I encountered a situation where I needed to adapt my communication style to effectively convey important information to a resident who had hearing impairment and limited English proficiency. This resident, Mr. Lee, was struggling to understand the changes in his care plan due to language barriers and hearing difficulties. Mr. Lee was a resident in our care facility who primarily spoke Mandarin and had significant hearing loss. Despite efforts to communicate with him using basic English and gestures, it was clear that he often misunderstood important details about his medication schedule and dietary requirements. My task was to find a way to effectively communicate with Mr. Lee to ensure he understood and followed his care plan accurately. This was essential for his health and well-being, as well as for ensuring his comfort and engagement in daily activities. Recognizing the challenge, I sought assistance from a bilingual colleague who spoke Mandarin fluently. Together, we developed a strategy to use simple Mandarin phrases and visual aids, such as illustrated medication schedules and dietary charts, to supplement verbal explanations. We also adjusted our approach to speaking clearly and facing Mr. Lee directly to help him lip read as much as possible. During interactions, we ensured to speak slowly and repeat key information using different words to reinforce understanding. Additionally, I made efforts to build rapport with Mr. Lee, engaging him in casual conversations to establish trust and comfort, which further facilitated effective communication. Over time, our adapted communication approach proved successful. Mr. Lee became more confident in managing his medication and dietary needs, showing improved compliance with his care plan. He also seemed more relaxed and engaged during our interactions, which indicated his growing comfort and understanding. This experience highlighted the importance of adapting communication styles to meet the specific needs of individuals under my care. By leveraging language skills, visual aids, and patient-centered communication techniques, I was able to ensure Mr. Lee received the necessary information clearly and effectively, enhancing his overall experience and quality of care in our facility.
Do you have any questions?
Yes, I do have a few questions. Could you please describe a typical day for a senior carer here? What opportunities are there for professional development?